I'm Drea Jones, a family physician at UNMC and North Omaha community member. Thanks for the invitation to speak with you all today. I am truly honored and grateful for this opportunity. While it is unfortunate that we're unable to gather today in person for this annual North Omaha Community Care Council Impact Luncheon, I appreciate prioritizing our health and safety. I want to give a special thanks to the NOCCC Luncheon and Connectivity Chairs, Lynette Ingram and Christian Minter, who I've worked with over the last few years through the Adolescent Health Project and Power to Decide's reproductive well-being work.
Our theme for today is putting our community first. I'd like to slightly amend that theme and pose it as a question. What does it mean to put our community first when it comes to healthcare and wellness? How do we do that, given the long history and ongoing reality of racism and economic inequality in our society? These are vexing and complex questions that require more than just 20 minutes to fully hash out. But I'd like to share some of my broad thoughts in response as a frontline family medicine physician in North Omaha. First, it is imperative that we think about and understand these issues in a broader context with a deeper, often troubling and even tragic history. Health and wellness, both for individuals and communities, do not take place in a vacuum, but within and as part of a particular history and culture, and through existing institutions, structures, and policies that have been created over a long period of time, pounded out within the crucible of power and oppression. As such, from the get-go, we need to be frank with ourselves and others about the fact that individual and community health outcomes have been and continue to be profoundly shaped by racism and economic inequality, particularly for people of color. We have a slew of data across a wide range of health-related issues that we could turn to and exemplify this depressing reality. Most of you, I'm sure, are aware of this reality, so I will not bore you by rehashing that data here. The truth is, though, that historically communities like North Omaha have not been put first. And it is that reality that is the primary force behind persistent and ongoing health disparities. My basic point here is that we have to see the environment we operate in clearly, with an unvarnished perspective. And for people of color, the most salient force shaping our health has always been systemic or structural racism and economic impoverishment. In this graphic on the slide, you can see the breakdown of social determinants of health, with socioeconomic factors being the most determinative, followed by individual health behaviors, the healthcare system, and the physical environment. Each of these four determinants, though, have been and continue to be overwhelmingly shaped by racism and economic inequality. Public policies have systematically impoverished Black and Brown communities, kept us segregated from more affluent white communities in substandard housing with inferior schools, deteriorating or neglected infrastructure, less access to nutritious and affordable food, higher proximity to a range of environmental hazards, and on and on. Even the places where we maintain the greatest power and control over our individual health choices is still significantly impacted by these realities. For instance, individuals may wish to make healthier personal choices like eating more nutritious foods, getting regular physical exercise, or actually seeing your doctor every year. But if you're unemployed or poor or working exhausting or even multiple jobs, you may not have access to or the means to afford these choices. In any case, if we're to improve the health of individuals in our community, we must address all four of these determinants. Stay focused on the broader structures and policies, then advocate for and enact sweeping transformative change. Health and wellness, as this slide makes clear, are intimately intertwined with the wider social matrix of racism and inequality. To put our community first in terms of health and wellness requires a broad community revitalization in North Omaha. There is just no other way. Over the past decade or so, we have heard a lot about revitalization efforts in North Omaha. And in recent years, we can see glimpses of hope, signs of emergent new possibilities. The Empowerment Network, Culture House, Ivy Black Girl, Black and Pink, the Union for Contemporary Arts, the Highlander, Malcolm X Memorial, the 24th and Lake Historic District, and a range of nonprofit organizations that are focused on community uplift. There is energy and some great things are happening. Health and wellness have to be a fundamental pillar in this process of community revitalization. Certainly, creating more jobs that pay a living wage, more quality housing for a range of income levels, better roads and infrastructure, more green space, better access to affordable, nutritious food, improved educational opportunities, decreases in drug use, crime, and violence are central to overcoming persistent health disparities. Quality, state-of-the-art facilities truly matter. And we can point to other developments that promote everyday healthy lifestyles in our community, like the new fitness and food options at the Highlander. Or the Juneteenth night ride in North Omaha, sponsored by the Culture House this summer. Here's a video snippet of that fun event.
I woke up to the morning sky first.
Others have emphasized community gardens, seed shares, farmers markets, and other programs and events aimed at overcoming food insecurity. And we continue to work on mental health as an important component of our physical health and overall well-being. And I suspect several of you in the audience today are part of a number of other programs oriented in many different ways toward promoting healthier living in North Omaha. These efforts are all an integral part of cultivating and sustaining a positive, accessible, inclusive, holistic, and mindful health culture in North Omaha, and supporting individuals and families to make smarter, healthier choices. In a volatile time where there's so much at stake, with movements like Black Lives Matter, Me Too, the COVID crisis, the ongoing political dysfunction at every level in our democratic system, many feel despair, like things are happening and determined beyond their control, stressed in so many ways. But taking ownership of your health and the choices that you're willing to make to improve your health and those around you, from maintaining a balanced diet, staying physically active, seeing your doctor for that annual checkup and age-appropriate cancer screenings, is, in fact, a form of empowerment. There is power in prevention. So as we look around, we can see some good things happening. But I want to keep it real as well. None of this is remotely enough. If we look honestly at the magnitude of the problem, our current solutions are, at best, a few drops in the bucket toward the kind of widespread, integrative, and transformative change necessary to actually overcome them. While we have seen dozens, maybe hundreds of new jobs in housing spring up in North O over the past decade, we need thousands of each of these to address the true problems of unemployment, poverty, and decent, affordable housing. While the relatively new facilities I work at the Fontenelle Clinic or Girls Inc., are an improvement over what was before, North Omaha continues to be the home to the greatest and most pervasive health deficits and inequalities in our entire city. It remains radically underserved and under-resourced by the formal healthcare system, in no small part because of the so-called return on investment. It makes health and human sense to invest millions of new dollars into the healthcare infrastructure of North Omaha to meet and bridge the pressing health disparities in our community, and to put our community first. But it makes little dollars and cents from the vantage of those doing the bean counting. And while we are more conscious of the mind-body connection and the need to promote individual health and well-being through more opportunities and better choices, we also know that individual choices are often constrained by systemic and structural realities that make purchasing more nutritious foods or finding the time to exercise daily or getting the yoga class on that Saturday morning more challenging and sometimes even impossible. This is all a sobering truth to confront. Each of us, as individuals and organizations, want to be positive and remain hopeful. But at the same time, we don't want to be naive. What we're talking about when we ask, how do we put our community first, when it comes to healthcare and wellness is in fact overcoming literally decade upon decade of structural systemic discrimination and inequality, not only in healthcare, but in virtually every other dimension of our lives and community, locally and nationally. It's a massive lift, and we need to be crystal clear about that. Honestly, if I think back to the end of 2019, I was actually looking forward to 2020. I know, in hindsight, that seems impossible to comprehend. I was thinking about that 2020 and hoping it might live up to a year of perfect vision, a clarifying time. And it was, but not in any of the ways that I might have considered. In March, COVID struck and shut down our society and the world, turning healthcare and everything else on its head. In May, the grotesque killing of George Floyd spurred a new racial crisis and the largest wave of protests in American history. And the Me Too movement, issuing a generational challenge to sexual harassment, abuse, and violence, as well as the broader inequalities facing women. In fact, 2020 was a year of perfect vision, and it was extremely clarifying. 2020 surfaced and made inescapable, stark, really, the pre-existing patterns of discrimination and inequality that had always been there, but which were too easily ignored or pushed aside by those with power and influence, no matter what people like I or you might have said to them at the time. 2020 made the health and racial disparities in our community brutally clear. And we heard so many promises by civic leaders and leading institutions that, quote, we were in it together, and that this time would be different, end quote, in addressing racism, discrimination, and inequality. But the truth is, in the year and a half since COVID snuck up on us and Black Lives Matter rattled our cage, the nuts and bolts response in our politics and on the ground has mainly further highlighted the ways our community is not put first, and the kind of malignant tolerance of the status quo that remains pervasive among those with power. Again, these are some hard truths to face, but we have to keep it real. The past 2 years have been devastatingly difficult for so many of us in this community. We are living through a paradoxical moment. On the one hand, as I said, COVID and Black Lives Matter have surfaced and highlighted existing inequalities and the inadequacies of business as usual. In that regard, in addition to being exhausted, our current predicament can feel a bit depressing. On the other hand, moments of crisis and social upheaval also contain within them the potentials for transformative change. The regular way of doing things gets knocked loose, and there is some new room to maneuver and press for change. Which side wins out in the end is usually determined by the degree to which historically marginalized groups and their allies can organize themselves and find innovative ways to raise their voices, assert their interests, articulate constructive solutions, demand accountability, and force action. Our healthcare systems had this initial wave of hope with the availability of vaccines and COVID cases decreasing. However, with the arrival of the Delta variant in mid-summer 2021, our hopes of ending the pandemic anytime soon were shattered. Saddened by the ongoing human devastation of COVID, exhausted from begging people to do the right thing, and burned out by the constant grind of our job, the healthcare community joined and pleaded with local leaders to protect us. Instead of listening to our healthcare experts, our governor, mayor, and several other elected officials stubbornly opposed vaccine and mask mandates, putting political interests before the health and safety of our very own community. While our county has made significant efforts to address low vaccine uptake in communities of color, we still have work to do. As I stated during our recent Douglas County Board of Health meeting, what we are doing is not working. What innovative, focused approach will we take to improve our North Omaha vaccination rate? What will it take to instill a sense of urgency in all of our Omaha community members to assist with this task and help build vaccine confidence? I really wonder what the response and call to action would look like if only 1 in 3 West Omaha community members were vaccinated. When will North Omaha become a priority for all of Omaha? To be successful, it often takes local activism and grassroots efforts both within and outside of the North Omaha community. The partnership between the Douglas County Health Department, Nebraska Medicine, and Girls Inc. hosting vaccine clinics is a great example of this. During the early phases of the vaccine rollout, we heard recurring messages about limited access to vaccines and less about vaccine hesitancy within our community. A collaborative of healthcare workers and community leaders organized to help address the disparities in vaccine access, and we successfully provided over 5,000 vaccines from March 27th to May 16th, 2021. And as we have seen, the cumulative effects of historic inequalities, as well as the inequalities that have played out in our response to COVID, have had tangible results. What remains clear is that our community deserves health equity and continues to not get it. To achieve that, as this graphic shows, we must create and maintain a truly integrative, coalition-based approach to community health in North Omaha. We need a much higher degree of cooperation and interconnection between individuals and organizations, and the space to be much bolder and more innovative in how we approach this work. And this is why what the North Omaha Community Care Council is doing is so important. And many of us have been and continue to do this work. But as anyone in the trenches knows, it is not enough, and those of us already in here need much greater support. This means building up internal resources, leadership, and organization within the community, and it also means reaching beyond the community to build the broader partnerships necessary to achieve our goals. After all, the health and well-being of North Omaha is inextricably linked to the health and well-being of the wider city, state, and nation. Building these kinds of integrative networks also serves another function: sustenance and support. Many of us who are on the front lines of these issues are overworked, exhausted, and stressed out, and we often feel isolated in our struggles to press on our efforts and effect real change in our immediate orbits. We are languishing, as I was recently told during a faculty development meeting. This is a long-term fight, and we need to find ways to nourish and sustain ourselves and others for the long haul. Healthcare workers have continued to provide care for patients despite pure exhaustion, personal risk of infection, and fear of transmission to family members. There has been this dual trauma of caring for patients through a global pandemic and caring for and being a part of a community that has been so needlessly hard hit by the pandemic. The Omaha Mochadocs and its allies have provided a critical support system for us, physicians of color. Unfortunately, there's just not enough of us to go around and do the work that needs to be done. And this is why it is so imperative for us to invest in our youth, in our future healthcare professionals. And just as a reminder, there are several pathway programs that are available at UNMC. We must model the desired behaviors, and most importantly, we must lead with love and honesty to continue these important conversations. There has been a common theme of misinformation and distrust when it comes to the pandemic response in our country. Who can we trust? Misinformation has become so powerful, persuasive, and corrosive. As a primary care physician in North Omaha, I struggle on a daily basis to educate, address specific concerns, and instill vaccine confidence in our community. This is not the time to give up on these conversations or let our guards down. We have to encourage our community members, friends, family members, and loved ones to not wait another day. At this point, these deaths are completely preventable. The last few years have not been easy. The various parallels of the COVID-19 pandemic and systemic racism are glaring and undeniable. Unfortunately, some people choose not to recognize or address them until they're personally affected. I can assure you, We cannot effectively make progress without the broader support of the entire community. It is the impact, not intentions, that matter and create sustainable change. Black Lives Matter, North Omaha matters. I thank you for your time and attention. Have a blessed day. Body, stay clean. Get your vaccine. We fought no clinic, 50th in Ames. And if we ever want this pandemic to end, we gotta get our shot, 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 get your vax, get your vax, get your vax. COVID crazy, curvy, daily, big cases, no end. COVID crazy, daily, big cases, no end. Get your vax, 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 get your vax. Look how you work at home, only if you can. Gotta teach the kids, doing best you can. Can't even breathe, have to wear a mask. Keep your distance, don't make me ask. Stay 6 feet at all times, don't play around. COVID taking lives, wash your hands, gotta wear your mask. So we can go, get on back to class. Get your vax, 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 get your vax. Body achy, sleepy, maybe big difference, little pain. Body achy, sleepy, maybe big difference, little pain. Get your vax, 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 get your vax. I'm a healthcare worker, gone, got my vaccine. All my patients been asking questions through this quarantine, but I'm very well, as you can tell. And we want to keep you all healthy just as well. If we took a trip down on the wards right quick, rule number 1, don't repeat that, shh. Rule number 2, if Rona came with you, they better know exactly then what to do. Get your test, get your test, get your test, get your test, get your test. Call your doc, call your doc, call your doc. Get your vax, get your vax, get your vax. Body achy, sleepy, maybe big difference, little pain. Body achy, sleepy, maybe big difference, little pain. Get your vax, get your vax, get your vax, get your vax, get your vax.